Welcome to this February 15th, 2024 webinar recording from California Department of Healthcare Services, facilitated by WestEd. In this video, all information conveyed visually is spoken by the presenters. Thus, this video's content is accessible for users who are blind or visually impaired.
Welcome, everyone. Good afternoon. We are so glad you're here for today's webinar to provide you with information for new LEA BOP coordinators and their onboarding. As a reminder, LEA BOP stands for the Local Educational Agency Medi-Cal Billing Option Program. Next slide. We are going to start with some really quick introductions and introduce the folks from the Department of Healthcare Services and WestEd who are on today's webinar. So we'll start by introducing the LEA BOP operations and DHCS team. I invite folks to wave when I get to your name. So from DHCS today, we have Sarah Burkowski, Lydia Outland, and Stephanie McGee. And then from the WestEd team, we have Jeremy Ford, myself, Lisa Eisenberg, my name right. We have Lisa Morris, Colleen Meacham, and Malachi McCormick. Next slide. So the next hour, we're going to spend and provide you with an overview and description of the LEA Medi-Cal Billing Option Program, or LEA BOP coordinator role. As a quick reminder, LEA BOP provides reimbursement to LEAs for health-related services provided to Medi-Cal enrolled students under the age of 22 and is managed at the LEA level by an LEA BOP coordinator. And so this workshop is going to delve into the scope of the coordinator's role, including specific responsibilities, coordination, and collaboration that's required at the regional and state levels. And then we'll also leave you with some resources to learn about best practices and get more information on administering the LEA BOP at the local level. I want to do a really quick note that this webinar is focused on the LEA BOP coordinator role and does not provide an in-depth overview of the program, including what the program covers and how reimbursements are managed. So we really encourage you, if you would like that overview of the program, definitely check out a training that we did in March of 2023, which is titled Funding School Health Services Through Medi-Cal, an Introduction to LEA BOP. Hopefully many of you were actually on that webinar, and so you remember that webinar. We are dropping a link in the chat to where you can access the webinar slides for that presentation. So back to the goals for today's workshop. We are hoping that you all will walk away understanding the responsibilities and scope of the LEA BOP coordinator role, understanding the necessary collaboration with your local educational consortium, or LEC, and the Department of Healthcare Services, or DHCS. And then we hope you'll understand the resources available for you all to learn more about best practices and grow in your capacity as an LEA BOP coordinator. Next slide. So here is our agenda for the next hour. We will begin with a really quick review of LEA BOP and the program, as well as the LEA BOP administration ecosystem. Then we will go into the role of the LEA BOP coordinator, including a breakdown of internal responsibilities within your LEA and external responsibilities, both with the Department of Healthcare Services and with the local educational consortium, or LEC. Then we will provide you with some resources and ongoing growth opportunities to support your coordinator role. And then we will follow that with time for questions and answers, and with a closing and next steps. So we want to encourage you to use the chat field to submit questions throughout the workshop. We do have folks on this webinar that are monitoring and making note of questions that are submitted via chat. And so we will either respond during today's training, during the Q&A, or in writing after today's workshop. And then I know this question has already come in through the chat, but presentation slides and a recording of today's webinar will be posted on the DHCS website in the future, and participants will be notified via email when those are available to check out online. Next slide. So as I mentioned, we're going to start with an LEA BOP overview. Next slide. So I mentioned this already a little bit, but as a reminder, LEA BOP is an optional program for LEAs to recoup some expenses for providing covered health services for students enrolled in Medi-Cal. And Medi-Cal is California's Medicaid program. And Medicaid, if you're not familiar with it, provides health coverage to millions of Americans, including but not limited to eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. And Medicaid is administered by states according to federal requirements. And this program is funded jointly by states and the federal government. So you all are part of now this Medicaid system, which is very exciting. Also, LEA BOP is an ongoing funding stream through reimbursements. So one of the benefits of LEA BOP is that it reimburses for your actual costs of providing services. LEA BOP covers certain expenses and practitioners, but not everything that you might be providing in your school setting. And then for a full list of those covered services and practitioners, again, see the link in the chat to the training we did that provided an overview of the whole program in March of 2023, which again was titled Funding School Health Services Through Medi-Cal, an Introduction to LEA BOP. That training also provides much more information into the details about how this program is funded and administered. And again, today's webinar is really focused on your role as the LEA BOP coordinator. Next slide. So we've structured today's webinar to reflect what we're calling the LEA BOP administration ecosystem. So you are the LEA BOP coordinator. The LEA BOP coordinator is the primary person responsible for the administration of LEA BOP, and they will sit in the hub, or as the hub, as illustrated on the graphic in your slide, interacting with many other partners, both internal to the LEA and external to LEA. The coordinator role has relationships and responsibilities internal within the LEA and external at the regional and state levels as indicated by the graphic. So the LEA BOP coordinator works internally with direct service practitioners who are the staff and individuals providing direct services to students, and with the LEA's administration, which could include human resources, accounting, financing, special education, and student services divisions or departments. So on your graphic, these entities are represented by the blue boxes. And then at the regional level, the LEA BOP coordinator works with the local educational consortium, or LEC coordinator. And last but certainly not least, the LEA BOP coordinator works with DHCS at the state level. And both of these are represented by the yellow boxes in the graphic on your slide. So throughout the rest of today's workshop, we're going to go into more detail on the specifics of these responsibilities and how the LEA BOP in particular interacts with each of these three parts of the program ecosystem: the internal partners, the regional partners with the LEC coordinator, and the state partners with Department of Healthcare Services. So hopefully that helps ground you into our conversation today. and I will turn it over to my colleague Jeremy, who will go into more details of the program ecosystem. Next slide.
Great. Thank you, Lisa. So yeah, let's dive right in. So as a new LEA BOP coordinator, either new to the role or your LEA is just getting started in LEA BOP, there are certain aspects of the program you'll be responsible for setting up and managing on an ongoing basis. These aspects generally fall, as we mentioned before, into internal responsibilities or those coordinating within your LEA, and external responsibilities, for example, the Local Education Consortium and DHCS. Next slide, please. Let's first tackle the internal responsibilities of the LEA BOP coordinator. On the slide is an overview, and I will be covering more information on each of these items in the next few slides. But these responsibilities generally are compliance paperwork, billing systems and vendors, fiscal system, training and technical assistance for staff and practitioners, and the LEA Reinvestment Committee. Next slide. First, let's start with compliance paperwork, the best part. The specifics will differ if you're a new LEA or a new LEA coordinator coming into an existing program. You'll need to figure out your LEA's current billing status, meaning verifying that you're fully enrolled in the program, including these documents. The Data Use Agreement, or DUA, the Provider Participation Agreement, or PPA, both of these are part of the initial enrollment process. If your LEA is already enrolled, these documents will have already been taken care of, hopefully. If your LEA is new to the program, you may be completing these forms as part of the enrollment process. Please note that the DUA does need to be updated every 3 years after the initial enrollment. The annual report and the cost reimbursement and comparison schedule, or CRCS, are annual documents. You will, one, need to figure out the current status of their submission. It may even be possible there's a backlog of unsubmitted documents that will need to be completed. And then two, you will need to know where these are saved and stored in case of audits or if you need to reference them. To access a copy or obtain a blank form to be completed, you can email DHCS at lea.annualreport@dhcs.ca.gov, and you can request your PPA and annual report there. Next slide, please. Next, let's talk about your billing system and your vendor if your LEA is using one. Your LEA's billing system should be able to document services, submit interim claims, reconcile claims, and payments received. This may also be called your billing vendor, and there is likely, and they will likely provide additional services to this basic list. You'll need to review your contract and make sure that the system is working for you, your LEA, and your practitioners. Working with the vendor is optional, and DHCS doesn't recommend any particular vendors. Next slide, please. Let's talk about your internal fiscal systems. Your LEA already has some fiscal reporting and accounting system. To complete the cost report, your role is to work with your business office to pull information about the cost of providing covered services to students. This includes staff salaries and benefits, contractors' costs or their invoices, supplies, and equipment related to covered services, as well as other costs. Without this system, you will not be able to comply with the cost reporting or the CRCS and other program requirements. Next slide, please. Training and technical assistance for staff and practitioners is a vital part of your internal systems. Staff and practitioners will need your support with documenting services, completing random moment time survey moments, and navigating the documentation systems that your LEA uses. You will also play a role in following up with practitioners and their supervisors to ensure program compliance. One example of this is making sure that there's a care plan in place for treatment services that are being provided to students that you're planning on billing. How you will provide those trainings will vary. You have to ask yourself, is this something done in-house or something that you'll work with your vendor to complete if you're using one for that? Next slide. The Reinvestment Committee is a requirement of the annual report and the provider participation agreement, with the requirements originating from California's Ed Code. In short, this is a group of people that develops a decision-making process regarding the reinvestment of funds made through participation in the LEA BOP. Do you have support needed to hold these meetings? Or will this be something you'll need to create? You'll have to be able to answer those questions. Next slide, please. We covered a lot of information on the last few slides and a lot of questions that you'll need to answer. But I want to point out that no LEA BOP coordinator is an island. Your LEA will need to support you for your internal responsibilities or with your internal responsibilities in order for the LEA BOP to be successful. These supports are your direct service practitioners. The direct service staff will be your strongest connection to covered services, the students, and the data entry process. For example, one suggestion for the path of least resistance with them is to work with your practitioners to adapt your LEA BOP to the systems they already have in place. So you're not adding more to their plate, but still make sure to meet program requirements. For example, your nursing department might have a medical record system that they already use to document services, and maybe it's going really well. You may want to figure out a way to securely export that information into your billing system instead of asking your nurses to use both systems. Then we have the supervisors of the direct service staff. They will be your allies in communicating program requirements to practitioners, including setting up trainings and following up on missed moments and missed service documentation. Then we have the fiscal office. We mentioned them before, but those people will either be running the reports you need or showing you how to access them. Again, this includes the service costs, salaries, benefits, contractors, and all the other costs we mentioned before. Administrative support covers a wide range of activities, from printing training materials to ensuring the board or executive approvals to reviewing contract language. Enhancing collaboration and garnering support from key decision makers and leadership within your LEA are crucial factors to ensuring the seamless and successful operation of the LEA BOP. Next slide, please. Now we start to look at some of the external responsibilities, starting with DHCS. DHCS is an oversight agency accountable to the federal government for the appropriate implementation of LEA BOP. This role includes providing oversight, guidance, training, and technical assistance. DHCS also develops and implements policy pertaining to LEA BOP and federal rules and regulations. As part of that oversight, a major component is compliance reporting. At the end of this webinar, we will link you to the DHCS website with these requirements, but I want to draw your attention to the fact that as the coordinator, you will be directly responsible for making sure these items are submitted. A few important examples of required reports that we've also mentioned earlier are the cost and reimbursement comparison schedule, the data use agreement, the provider participation agreement, and the annual report. As mentioned previously, DHCS is not just there to ensure compliance, they also provide guidance and learning resources for program administration to help LEAs implement the program efficiently and effectively. Next slide, please. The next external responsibility is the Local Education Consortium, or LEC. Each LEC, by and large, administers the program in the same way, since for the LEA BOP, their primary role is administering the RMTS, the Random Moment Time Survey we talked about earlier. However, individual regions may vary in the types of supports and resources they provide to participating LEAs. You, as the coordinator, will need to work with your LEC to identify the RMTS administrative details that are specific to your region. For example, you'll need to answer at least these questions. What RMTS system will you be using? How will you log into that system? What is the process for updating your time survey participant or TSP list? And when are the deadlines for submitting your TSP list to the LEC? Is there a process in place to follow up and review RMTS moments? Your LEC will help you identify the answer to all of these questions and the role you play in them. This is something that you'll need to work out between your LEC and your LEA. If you're not sure which LEC region you're a part of, or you don't have that contact information, please see the link in the chat. That is a regional map, and it'll connect you with the appropriate LEC. Next slide, please. Going back to our conversation on DHCS, they also provide supports like training. If you're brand new to this program, so far you have probably been taking notes on all the items you need to follow up with, and it's a lot. We will be providing a list of resources at the end of the webinar. Again, I just want to remind that, but for right now, I want to give you a few very specific next steps to get you started, starting with the training page. The training page is separated by school year and then by topics. You can locate the topic that is most relevant, but in addition to the trainings we talked about already, I want to recommend the following. We have the April 2023, and these links are also in the chat, relaunching your LEA BOP, understanding the program for strategies for success. And then we have the December 2023 CRCS training that's specific to the cost reimbursement comparison schedule. And then the October 2023 LEA BOP and the time survey participant or TSP list training. Feel free to review all the trainings, but I think these are a really great place to get you started. Next slide, please. The training page is one very valuable resource, but there are more online resources and tools for DHCS support. For example, the provider manual. As the LEA BOP coordinator, I can't stress this enough, you should be very familiar with the provider manual and its various sections. One of the primary responsibilities is ensuring accuracy of billing. This resource will be your primary source for all billing requirements of the program. The policy and procedure letters, or PPLs, are issued by DHCS to communicate essential policies and procedures in a timely manner, with the goal of integrating into the next provider manual revision. So the PPL's purpose is to ensure program consistency, informing stakeholders, and promoting compliance with legal and regulatory requirements as they are changed. It's something done in the moment. Another feature is the ability to go into greater details, often providing steps to assist with compliance. So please be familiar with the provider manual and then also review the PPLs. Then we have the toolbox. Here you'll find the tip sheets and other important program documents from DHCS. Feel free to explore the different tip sheets on different topics. The work of an LEA BOP coordinator doesn't stop there, though. Next slide. As an LEA BOP coordinator, it's always a good idea to keep learning about best practices, stay informed of updates to the program, and participate in opportunities that support your ongoing growth. One of the best ways to connect with both DHCS and your fellow LEAs is to attend the quarterly stakeholder meetings. And starting in April, attend their best practice sessions. I'm putting some links in the chat that everyone should bookmark. This is not an exhaustive list by any means, but it's a good place to get started. We have the DHCS LEA BOP website. We have the California Department of Education. You'll find all kinds of different resources and regulations there. And then we have the National Alliance for Medicaid and Education, which is a national organization that promotes collaboration in school-based Medicaid programs. Make sure to bookmark that. And they have an annual conference as well. You are now part of a community of school Medicaid nerds. Welcome. There's lots of us here, and we're all here to support each other. I did this job for 13 years, and I still consider myself an LEA BOP coordinator at heart. So let me send this back to Lisa, and we'll go to the next slide. Thank you.
Thank you so much, Jeremy. By our count today, there are at least like 150 plus school Medicaid nerds in attendance. So that's great. We love having you here. Welcome to this community. We're now gonna have a poll with some quiz questions. There's been lots of questions that you all have submitted in the chat. We really appreciate that. We will be getting to those questions shortly. So please make sure if you have any burning other questions to drop them in the chat. But before we move into answering your questions, we're gonna ask you a couple questions. So please take a couple moments to answer the quiz questions that will pop up as a poll. And these are really here to help gauge the usefulness of this workshop and for us to understand what information you are digesting. So we'll leave this poll open for a couple of minutes to allow you a chance to respond. But the questions are on your poll. 1, what is one internal LEA level responsibility of an LEA BOP coordinator? 2, what is one of the responsibilities of the LEA BOP coordinator concerning the LEC or Local Educational Consortium? And then 3, what is one opportunity for LEA BOP coordinators to engage with DHCS? So you should see the poll popping up. So please take a couple minutes to mark your answer in that poll. Thank you. All right, well, thank you so much for responding to the quiz questions. We will now walk through and review the correct answers. So next slide. For question number 1, my percentages are off, but almost 100% of you got the answer correct. Be familiar with your current LEA billing system or vendor. While many of you have several responsibilities, we did cover these responsibilities on slide 12, which is one of them is being familiar with your current billing system and or vendor is one of those internal responsibilities. Next slide. All right. For question number 2, looks like about 75% of you got the answer correct. Submitting the TSP list by the assigned deadlines. So this answer we covered on slide 18. You will need to submit your TSP list to your LEC or Local Educational Consortium. The other answers to this question are important things to do, but they don't necessarily involve your Local Educational Consortium. Next slide. So for question number 3, the correct answer is attend a DHCS stakeholder meetings. Looks like I would say about 80% of you got that right. Great. So while there are many ways to engage with DHCS, from the choices on this quiz question, and also as discussed on slide 21, one of the ways we encourage you to engage with DHCS is to attend the quarterly stakeholder meetings. Next slide. And now I think we can get to some of the questions that you all have been submitting and asking in our Q&A. So again, as I mentioned earlier, we will respond to questions that we received through the registration form. And then I think it looks like we'll certainly have time to get at least some of the questions that have been coming in through the chat. So again, we've been monitoring the chats, and we'll try to respond to as many questions as we can. But if there are any questions we don't have time to get to, they will be responded to via email and in writing after today's training. Next slide. So first are the questions from registration, and I invite our DHCS colleague Lydia to join us in helping answer some of these questions. So Lydia, one of the first questions we received via registration was, is there a list and or timeline of activities, responsibilities, and due dates that the LEA BOP coordinator should be aware of?
Yes, hello everyone. We have a wealth of very helpful resources to help keep track of due dates, timelines, and responsibilities. In the admin and audit checklist, you'll be able to find a timeline of key program administrative dates and activities, practitioner and service log checklist, and also in the internal administrative functions link that we will be dropping in the chats here in a second, you'll find a spreadsheet of LEA functions broken down by responsible parties. So please take a look at these couple links that we'll be dropping in the chat. And if you have any questions, please don't hesitate to reach out to the LEA inbox.
Great, thank you. Okay, so the next question we have from registration is, what is the LEA BOP coordinator's role in maintaining documents for audits? Do the documents have to be hard copies, or are digital copies okay? And how long should LEAs and coordinators maintain documentation?
Right, so documentation for audits, whether it's hard copy or digital copy, must be kept for a minimum of 3 years from the date of CRCM submission. Now, if your audit is in review or in process, an LEA must maintain all documentation until the audit is complete, regardless of the 3-year record timeframe. For additional information, please see these links that we will drop into the chat to the LEA BOP provider manual, and also please see the admin and audit checklist for reference and some other helpful information.
Great. So, all right, third question. We mentioned the role of the reinvestment committee in here. It's listed here as the LEA BOP Collaborative Committee. So, what role should the coordinator, role could or should a coordinator have in the LEA BOP Collaborative Committee or Reinvestment Committee?
Right. So like you said, as mentioned earlier, establishing a LEA local collaborative group at the county level or sub-county level is required in the provider participation agreement. And this collaborative group is made to make decisions about the reinvestment of funds made available through the LEA BOP. And this group should include parents and guardians of the and teachers of the children receiving LEA funds, LEA providers, or potential LEA providers or representatives. And there are some assumptions that could be made regarding the coordinator's role in assisting with the organization and implementation of this collaborative, but it is ultimately up to the LEA who plays what roles. But for some specific examples, I'd love to turn it over to Jeremy.
Yeah, sure. Thank you. Yeah. So I worked at an LEA as an LEA BOP coordinator, and in Oakland, what we did and how this can work can vary, right? The responsibility is that you come up with a system and a group of people to basically spend the money. But we put together a proposal system, so people would come with proposals, 1 to 3 pages, describing how the money would be used, and we had different criteria for judging it. One of the criteria was like, will the funds be leveraged, right? And we used to say that this was like the best spent money in the district, because it was such an intentional process to reinvest these funds. And so, just like one example, we had a proposal that was going to change the testing materials for our psych department. And how that ended up working is it would cost 50,000, and then another agency that we were working with would also put in 50,000 to match that expenditures. So in that way, we were able to really use that money very thoughtfully and come up with a new assessment system and purchase materials for that. So it was a really great process. That's just one example, but should this be run by the LEA BOP coordinator? Will you provide like that information and that guidance, or is it better for you just to kind of be there and provide information? So there's really a lot of questions in terms of like what makes the most sense for your LEA, but hopefully that's a helpful example.
Thank you. I definitely think it's helpful to at least spark some thoughts or considerations or questions that LEA BOP coordinators on this call might want to consider. All right, so the fourth and final question we got from registration, then we'll move into your chat questions, is what opportunities exist to sit down with someone who has been actively performing LEA BOP billing to see it in action or to ask questions?
This question is actually the perfect segue into our upcoming best practices sessions. So in April, we will be holding our next quarterly stakeholder meeting with the addition of these best practices sessions, which will discuss topics of interest and will present a wonderful opportunity for LEAs to network and connect with someone who is actively participating in the LEA BOP. Also, if you have any specific topics you would like discussed during these best practices sessions, please feel free to reach out to the LEA inbox at lea@dhcs.ca.gov.
Well, thank you so much, Jeremy and Lydia. We'll have you on for the next round of questions. So now we will move on to our questions that we're getting via chat. So next slide, please. All right, so the question we're going to answer is a popular question, which is, would you be able to speak to the difference between LEA BOP and the CYBHI?
Right. So this training doesn't focus on the fee schedule. However, this topic is discussed during the LEA BOP quarterly stakeholder meeting, in which the DHCS team that oversees the fee schedule will be in attendance and has been in attendance. So the next meeting will be in April 24th, 2024. So please be sure to join us then for further updates on this topic.
Great, thank you. All right, so the next question is, are the funds received through LEA BOP, are they considered federal or state funds?
LEAs receive federal funds through the LEA BOP.
And I just would add also the way they're coded in the SACS code is non-federal. So you are receiving the federal share of dollars, but when it comes to the LEA, they are non-federal dollars for the purpose of expending. Hopefully that helps.
Thank you. All right. Next question is which we sort of covered at the end of the last registration question, but we'll answer it specifically because it did come in through chat. Is there a list of schools that provide LEA BOP services that we might be able to connect with to learn from their experiences?
So DHCS does not publish a list of enrolled LEAs, but again, we have the quarterly stakeholder meeting coming up with that best practices sessions. So highly recommend joining us for that meeting to help build some connections and meet up with other LEAs currently in the program.
And I think I would just add on behalf of DHCS, I think questions about policy and compliance should always go to DHCS. There's lots of resources online. They're available to answer questions. We understand the desire to ask practice questions and get helpful guidance from LEAs. And we also really want to emphasize the role of DHCS in answering some of those policy and compliance questions that you might have. Okay, the next question I have is a big one, I think. Let me just read it and then I'll see if I can clarify it. In the LEA BOP provider manual, the description of eligible students that are covered under this program says that students must be eligible for federal financial participation and enrolled in Medi-Cal on the date of service. Can you give a little insight on what that FFP qualified means Is that differentiating or pertaining to undocumented students that might be eligible for state-only Medi-Cal? Is that what you mean? I think is the gist of that question.
All right. So LEA seeking reimbursement for services rendered to beneficiaries with an unsatisfactory immigration status are not eligible for federal financial participation reimbursements through the LEA BOP. We'll actually be dropping a link to PPL 21015R that you can please feel free to read for more information on that topic.
Great. So I think students must meet federal requirements for eligibility under this program, which might differ between the feds and the state of California. So that's just something to keep in mind. So next question is, are there minimum requirements for who can be on the LEA collaborative, reinvestment collaborative? Who decides who is on the LEA collaborative?
Well, this question was actually a little bit covered in our previous question and question, I think it was 3, regarding who would be on it. Would be parents of students, LEA BOP practitioners, or providers or potential providers, as I listed before. But again, the setup of these meetings are really up to the LEA to organize and develop.
Question is, if we are looking at getting a vendor, would we wait to fill out, to submit all your enrollment paperwork as an LEA BOP provider, or can we enroll and enroll in the program and then add using a vendor later?
Right. No, you don't need to wait at all. Since the billing vendor is not mandatory for participating in the LEA BOP, your LEA can get started on the application process right away while you make the decision on the vendor. So yeah, please send in that paperwork.
Great. We have time for a couple more questions. Lots of questions about the reinvestment committee, as we anticipated. The question is, are there guidelines regarding how the funds received through this program need to be reinvested? For example, can funds cover health or mental health professionals?
So California Code, the Education Code EDC 8804 regulates what is appropriate for reinvestment of funds. We recommend reviewing that code and then working with your fiscal team to determine what is best for your LEA.
Great. I think, Jeremy, this is a question that somebody put in as you were providing examples of your past role as the OUSD LEA BOP LEA BOP coordinator. I think you mentioned people had to submit a proposal for funding, and the question is like, do you have a template for that proposal? And I will just say DHCS does not have that template. But Jeremy, I don't know if you wanted to add anything to that answer.
I would just add, I think there's a lot of value in developing the requirements for the proposal with the group of people who are going to be submitting the proposals. So that's how we did it. And I wish I could take full credit for leading that. It was my previous supervisor who is amazing. Shout out Mara. But the process was essentially, what do we value in this district, and how much money, roughly do we think we're going to get, and using those guidelines, develop a proposal that we would score based on these different categories. And so I think the value is in developing the template that works for your LEA. If you're looking at $1 million a year, are you planning to fund 10 projects at 100,000 each? Or if you're looking at 50,000 a year, are you planning on funding 2 projects at 25,000 each, right? And these are kinds of the questions that you'll need to decide within your LEA. Do you want to support expansion of services, or do you want to support innovative types of proposals that might change systems or processes? So these really, I think, should be decided amongst yourselves. Can you roll over funds year to year for larger projects? Sorry, I skipped the normal process. The annual report, one of the documents we talked about several times in this presentation. The annual report outlines kind of everything we're talking about here, like who's part of the investment committee. And I know we're out of time, so that was Christina's question, but like, or not Christina, sorry, Carrie. Like, who's part of the committee, and the different requirements of how much you spend each year, and there is a place to indicate how much you're rolling over from year to year. So, okay.
I'm going to acknowledge 2 questions and then say we're going to answer them in like our next slide. So the questions are, how do we make sure we know about the quarterly stakeholder meeting so we can attend? And then if we want to change the billing address where we receive funds, how do we do that? So both of those questions we will answer in the next slide. So we are going to wrap up the question and answer portion. Really much appreciation to you, Lydia and Jeremy, for jumping in and answering questions. But we are going to move, I'm going to move us along to our next slide. And thank you everyone for sending in those really excellent questions. So next slide. Great. This brings us to our next steps and closing for today's workshop. So we've shared a number of resources throughout today's workshop that are specific to your role as an LEA BOP coordinator. However, there are other resources that generally can support your LEA in all other aspects of administering the LEA BOP. So again, we encourage you to spend time, like my colleague Jeremy said, on the LEA BOP website. There's a link at the top of the slide, and we'll drop it in the chat. You can also reach out to DHTS for any questions that you might have through the LEA inbox. And we will drop a link to the LEA contact email in just a moment, but that's where you can send any requests to change your billing address. So also, we mentioned a number of times the quarterly stakeholder meetings. Information about those meetings is available online from past meetings, and you can find those posted materials on the link on the slide and in the chat. And to answer the question we got, what the best way to know when those meetings are happening is to sign up for the email subscription list. And there is a link in the chat and on the slide for where you can submit that form to be added to the subscription list. And then last but certainly not least, we definitely encourage you to sign up for technical assistance with DHCS if you have particular questions. And we're including a link to the technical assistance site visit request form on the slide as well as in the chat. Next slide. So that wraps us up for today's webinar. We really thank you so much for participating in today's workshop, asking those great questions, doing a great job answering the quiz questions. We hope you enjoyed today's webinar and learned something today. Again, really appreciate you all for tuning in and look forward to seeing you at an opportunity for more learning in the future.